On this gorgeous Wednesday morning, and we are now joined by Dr. Angelique Coetzee to talk about COVID-19, all the issues related to COVID-19. We understand that South Africa is possibly headed for stricter measures, level 2 lockdown, and let us understand what that's going to mean for us as South Africans. Dr. Coetzee, good morning. Welcome to the program, and thank you indeed for your time.
Thank you, Julie, and good morning to all your listeners out there.
So,
if we look at...
sorry about that. We're talking about level 2. What's that going to mean for us? And what determines, I'm trying to understand the factors that's going to determine that we are, in fact, in the third wave.
Julie, it's difficult to say that we are in fact in the third wave. We suspect that we are in, but there's numbers that you need to look at. And if you look at the per 100,000 people, it should be 6,000 per 100,000 people infected. Then you will officially say, or 40,000 people per week. Then you will officially say, I am in, or we are in a third wave.
Okay.
So it is. So you look at the 100,000 people. So the problem that we are sitting with is we are now in our cold and flu season, and the majority of patients, especially the under 40 years, will present with just a normal, snuffy nose and sore throat and a bit of a thick head and a sinus. And unfortunately, we actually now need to start testing for, either do an antigen test or do a PCR, because the symptoms on the under 40s are exactly more or less the same than that for colds and flu. So it makes it difficult, except if they are have loss of smell and taste. So your people above the age group of 40, they are a bit more difficult, and they also with their symptoms, and they take a bit longer to get over this. But the problem is the younger people, because within 2 to 3 days, they feel much, much better, can't understand that they need to stay at home for 10 days, and they are going to spread the virus for us very nicely.
How reliable or accurate is the antigen or the PCR as opposed to a full-blown COVID-19 test?
Okay, it depends on the timing. So your antigen test from the day that you are having symptoms, it's about 7 days. You have a window period of 7 days to look at your antigen. It's 99% sensitive. So after 10 days, if you then want to do an antigen, you can't really rely on it. So your antigens it needs to be done in that small window period. After 7 days, 7 to 14 days, your PCR will start getting positive. Then you can look at the PCR test. So if you do your PCR test too early, you will not detect. You will get a false negative. And that's the problem between the two. So we are using in the surgeries the antigen test to distinguish.
Okay, and what is the PCR? What does it stand for?
The PCR is, both of these tests are nose swabs, but the PCR will tell you about the virus itself, whether it detects the virus. The problem with the PCR test, if you go and do testing and it's positive and you don't have any symptoms, you're not in contact with anyone recently with COVID-19, it can be old viral particles that you are detecting, because I can't distinguish between live and dead particles. That's the problem. That's why we say, please don't go and test. If you don't have symptoms, don't go and test, please.
Okay. I do know that we're in the second week of the vaccine rollout in South Africa. Would you know offhand if it's if it's rolling out successfully, and what would the challenges around it be?
Look, everyone, depends on who you're speaking to. If you speak to government, they will tell you it's very successful. If you speak to the people out there, or some of the people involved, they will say, no, it's not that successful. But so it depends. So for those facilities that are doing their best and roll out very nicely without hiccups. We're very grateful for, but unfortunately, we're still having the walk-ins. That puts a huge strain on the system. You need to do the EVDS system. Also need to understand that healthcare workers currently can't register on the EVDS system. They've closed that system, and they now need to register on for healthcare workers. So, those type of things create confusion, especially around healthcare workers out there.
Okay. The issue around the Pfizer vaccines, which I understand is the shots that are being given out currently, you need to go for your second shot after 28 or 48 days, etc. Is that going to be rolled out successfully? One wonders, you talk about the walk-ins and how that causes an added burden to the system and to the frontline workers who are administering the shots. And of course, the people that are queuing for their vaccines. Are you confident that that's going to roll out successfully or as planned by government?
On paper, everything always seems so nicely and works out.
Yeah.
In practicality, the second dose will be 42 days later. It would have been 21 days. Now the problem is some of these patients already received their notification that 21 days later they will need to go for their second jab. So I'm not sure whether that's going to happen because the 42 days. The reason for that is we don't have enough vaccines. It seems that we have about nearly 3 million now registered on the over 60s. So, but we only have 1 million. So they try to postpone the second one to 42 days, so that you can try to vaccinate 1 million people instead of only 500,000. And while they're waiting for stock to come into the country. And remember, we're still waiting for FDA approval for Johnson & Johnson.
Right. Which I think a lot of people, myself included, is a bit nervous about the J&J vaccines. But that's a story for another time. Yeah. What happens, doctor, if I get the flu shot, my first dose of the Pfizer vaccine, and for some reason don't get around to getting the second shot in 21 or 40 days later? Maybe there's no stocks available, or maybe I just forget, or I just don't get down to it. What risk am I at in that scenario?
You're not fully protected. That's the problem. The protection is the risk. We know that with Pfizer, you need 2 shots, and around about 2 weeks after the second shot with Pfizer, your antibodies starts nicely to kick in. You will have some of the data, but remember, this is not South African data, and we've got our own variant here.
Of course.
But some of the data says, okay, you will have 80% protection, but you have to go for the second one, as that is not enough on one jab. So it might be that we end up with people half vaccinated going forward, and not really adding any benefit or value to the program.
But there is some percentage of protection, is there not? Be it 50% or whatever.
Yes, there's some, yeah.
Okay. What about once I've taken both my shots? How safe am I? And do I still, because I think there's a lot of complacency in the general public, how safe am I to go out and start mingling? Do I still sanitize, mask up, and social distance?
Yeah. And unfortunately, yes, you still have to do that. The data is not out yet that if you have been vaccinated, whether you can still spread the virus without you getting sick. So that's the reason why nothing of the non-pharmaceutical measurements, we call it the mask and the sanitizing, is going to go away. We think it's very irresponsible for the United States, to say that if you have been vaccinated, you don't need to wear your mask. In South Africa, that's not going to happen. We will still keep on emphasizing that needs to be done.
Okay, finally, people who've taken a flu vaccine, and it is flu season, so lots of people are going for their flu jabs. How long do they have to wait before they go for their COVID vaccines, or is it safe to take it on top of each other?
2 weeks. You just need to wait 2 weeks. there should only be the window, waiting period of 2 weeks. If you take your vaccine, your Pfizer vaccine first, wait 2 weeks, do your flu vaccine, or if you do your flu vaccine first, wait 2 weeks before you do your Pfizer.
Okay, that's where we leave it. We will talk with you again sometime soon. I do want to talk about black fungus, but let's leave that for another interview. Thank you indeed for all of the information shared with us on the morning.
Thank you so much.
Enjoy
your day.
And you. It is exactly 8:52, and we're going to go for an ad break. When we get back, I think we're crossing over to the Western Cape.